my dear students, I welcome you all, and today's topic of discussion is stricture urethra. Stricture of urethra. So this stricture of urethra will cause scarring and fibrosis. So this will cause scarring and fibrosis, and that will lead to the narrowing of the tube, taking urine outside the body, taking urine outside body. So the strictures will cause fibrosis and scarring, and that will lead to the narrowing of the tube that is taking urine outside the body. So what will happen in long term case? It will cause retention of the urine because of the inadequate emptying of the bladder. Now the etiology, the causes. So the causes are genetic, that is very rare. So genetic cause is very rare. We will find hardly a 1 or 2 patient. So genetic cause is rare. Then there is post-inflammatory cause. Post-inflammatory cause, where the patient has a history of a disease or a exposure to the venereal disease, exposure to venereal diseases like tuberculosis and gonorrhea. So tuberculosis and gonorrhea. This is post-inflammatory cause. Then there is post-instrumentation. Post-instrumentation. So if the patient is using catheter from long time or after using the dilators, so the conditions like dilatation, catheterization, or the procedure like transurethral procedure, where the resectoscope is inserted into the urethra. So transurethral procedure, which we have already seen in the treatment of BPH, that is benign prostatic hyperplasia. The resectoscope will irrigate with the help of water, and with the help of water it will remove out the excess of, or will trim out the prostatic tissue that is causing obstruction to the flow of urine. So this is the transurethral procedure. So these are the causes for stricture of urethral. Genetic cause is rare. Post-inflammatory, that is exposure to any venereal disease like gonorrhea or tuberculosis, and after inserting any instrument like in case of dilatation, catheterization, transurethral procedure. Then next is post-operative cause. So in post-operative cause, especially like in case of prostatectomy, when the prostate is removed, or in case of repair of rupture of urethra. So this is post-operative methods or procedures like in case of prostatectomy or repair of rupture of urethra that can also lead to the stricture of urethra. Then there is another reason, rupture urethra. So rupture urethra is also the cause for stricture of urethra. Then the very important factor is disease like schistosomiasis. So the rupture of urethra and the disease like schistosomiasis can also cause stricture of urethra. So these were the causes or the etiological factors. Now clinical features. In clinical features you will see, first the patient will give you the history that he or she is, he is suffering from or had a history of, so there is history is mainly present. So there is history of any disease, venereal disease like gonorrhea or tuberculosis. Or the patient has gone under any post-operative conditions or procedures, post-operative. So patient would have or would tell that there is history of operation, or there could be history of rupture of urethra or a disease like schistosomiasis or a venereal disease like tuberculosis or gonorrhea. Then patient will tell that he has to strain lot for urination because there is inadequate emptying of the bladder. So there is inadequate emptying of bladder, and that can result to the retention of urine. This comes in the complication. We will not take it in symptoms. So patient has to strain lot for urination. There is inadequate emptying of bladder, and because the urine is coming drops by drops, so there will be urgency, increased urge to urinate. So increased urgency, and there will be suprapubic pain. Because of the dilatation, due to dilatation of bladder. So because of the dilatation of bladder, there will be suprapubic pain. Also, there is increased chances for infections because there is retention of urine, stasis of urine inside the bladder. There is inadequate emptying of the bladder, and that will cause suprapubic pain due to dilatation of bladder, and the patient has to strain lot for urine. Then this stricture of urethra is felt like open button in perineum. Very important symptom. So patient will say that this stricture urethra is felt like a open button in perineum. So these are the symptoms. Then in treatment, we will do urethroplasty. So urethroplasty is the procedure to repair the injury or any defect that has occurred in the wall of the urethra. So it is the procedure to correct the defect or to repair that injury. So there are 4 types of urethroplasty, like reinforcement urethroplasty and substitution dilatations. So dilatations are done by using Lister dilator. So by using Lister dilator, dilatations are done. Then urethroplasty is the procedure of correcting any defect or injury in the urethra, in the wall of the urethra. And third way is visual internal urethrotomy. That is VIU. Visual internal urethrotomy done by the urethrotom. So this is the treatment. The surgical treatment includes the dilatations by using Lister's dilator. Then urethroplasty is done, which is the procedure to repair the injury of the wall of the urethra. And the third procedure is visual internal urethrotomy done by using the urethrotom. So this is the treatment. In complications, because there is retention of urine, so that retention will cause what? Retention will cause stasis of the urine and blockage. So there the organisms can proliferate and grow. So that blockage gives a full benefit to the bacteria to flourish. So because of this stasis and blockage, there could be stone formation and also recurrent infections. So the increased chances of infections, that to recurrent infections. Then there could be multiple abscesses formed in the periurethral region, and when this will burst, that will open into the perineal skin. So there will be multiple abscesses formed in the urethral skin, and when that abscess will burst, that will open into the perineal skin. So when patient will urinate, so in that patient will say that there are multiple openings because there will be multiple holes. So the urine will come out from the multiple holes from that perineal skin.